Hi, I am Dr. Bornali Datta, and I am here to discuss the critical need of the hour of strengthening India's healthcare infrastructure to continue the fight against COVID-19 and other diseases. It has been 2.5 years that we have been tackling the pandemic, and in this time we have lost 5.28 lakh lives to the pandemic, and 44 million Indians have got infected by the virus. Throughout the waves of COVID-19 in India, what was very obvious was that we completely lacked healthcare infrastructure to deal with the consequences of the pandemic. We lacked diagnostic, we lacked therapeutics, we lacked healthcare personnel, we lacked hospital beds, and of course oxygen. There was a great loss to life, and we could not avert that with the healthcare structure that we had available with us. Globally too, what we saw within the developed countries was an utter inadequacy to rise up to the challenge posed by the pandemic. They did not have adequate health infrastructure either. And so there was a vast social and economic inequity within and between countries. Infections are rising again, and there are numerous variants that are now globally present. So what have we learned from our entire experience of 2.5 years of dealing with the pandemic? Where do we need to increase our efforts? One of the key lessons from the pandemic has been that underinvestment in health can have devastating consequences on the societies and on our economies. Our political leaders need to invest in our healthcare systems, in the healthcare infrastructure, and understand that this is the biggest investment that they need to make to strengthen the economics of the country. India spends 2.1% of its GDP in health. That is grossly inadequate for a nation that has 1.2 billion population and is predicted to cross China as the most populous nation in 2023. There is no excuse for this gross underinvestment in healthcare. We have lost more people in the 2 years of the pandemic than we have in any war in the past. The COVID-19 pandemic has reasserted the importance of state-of-the-art diagnostics and therapeutics. We need to have epidemic preparedness. We need to have more health centers, hospitals, and more healthcare workers, better therapeutics and diagnostics that can give us cost-effective diagnosis. All of this is only possible with more investment and resources, and it is vital that the government recognizes this. Prioritizing investment in India's health system can significantly help us in tackling the current and future health threats that may come. While vaccines provide immunity to patients and the population at large, what we also need is diagnostic centers which can give us immediate diagnosis, appropriate treatment that can tackle all the ailments that are existing in our current milieu. Advances can only be made if meaningful investments are done into the healthcare setup of our country. We need immediate diagnostics, we need excellent therapeutics, we need healthcare personnel, we need good hospitals and healthcare centers where patients can have easy access to. Apart from all this, it is important to incorporate innovations, the latest cutting-edge diagnostic and therapeutics into our existing healthcare ecosystem. COVID-19 has reinforced that investment in healthcare has long-term returns and benefits. On the other hand, underinvestment in healthcare has devastating consequences at national, global, social, and economic levels. We cannot afford to underinvest in healthcare anymore, otherwise we will create another pandemic, this time by complete neglect. Thank you.